Raising Awareness on Bone Health, presented by Anushka Ivatury and Joshitha Bedhaputi. Bone health is a topic that's misunderstood and overlooked. When we think about health education in schools, topics like nutrition and cardio fitness take the spotlight, but bone health is rarely discussed. Injuries in sports, such as knee and joint damage, can have long term effects, and the importance of addressing bone health has only increased in the past decade, especially with the COVID-19 pandemic. SARS-CoV-2, which is the infection under COVID-19, had a significant impact on medical conditions around the world. With lockdowns and restrictions that limited physical activity, many people, especially those with bone disease, had a drawback in their recovery. The lack of movement and proper facilities had a detrimental impact on bones, and beyond reduced activity, the infection itself has been linked to many bone health challenges. SARS-CoV-2 causes hypocalcemia, which is the decreased calcium count in blood. The virus triggers a strong inflammatory response that's known as a cytokine storm, which also contributes to bone loss. Despite the common misconception that bone health is only a concern for older adults, about 54 million Americans are estimated to have low bone mass, putting them at an increased risk of fractures. The mortality rates after hip or vertebral fractures are significantly higher, and low bone mass is responsible for over 1.5 million fractures annually, leading to about 500,000 hospitalizations and nearly 200,000 nursing home placements at a total cost of about $19 billion. This cost is projected to rise by 50% by 2025. Common misconceptions about bone diseases include it's seen as an old people disease. It's associated only with physical aging and is a demanding lifestyle. They lack awareness about their diet and exercise and genetics. And there's an underestimation of the long-term impact and prevalence throughout life. Our first solution, Bone Health Education Act. So why aren't schools doing more to prioritize bone health education? In health classes, it's often overlooked and the focus is placed mainly on nutrition and fitness, drug abuse, and sexual and mental health. And in sports training, the focus is on short-term performance instead of long-term injury prevention. Schools across the United States, generally guided by the National Federation of State High School Associations, or NFHS, cover a wide range of important health and safety topics for student athletes. These include first aid and emergency response training, concussion awareness and management, heat illness prevention, and cardiac arrest, along with sports-specific training that focuses on developing skills and understanding rules. While these are undoubtedly essential, they leave a lack of education on bone health and its long-term impact on athletic performance. Our solution to this is the Bone Health Education Act. This policy makes it mandatory for NFHS to instruct all athletes in all education spheres, whether public or private, on bone diseases, bone safety, and bone health. Our second solution is the Bare Bone Blog, using the power of human empathy to tell stories. Primary care providers and other sources would tell patients to keep their joints moving, exercise, don't overexert yourself, eat well, but don't smoke, don't drink, relax, don't stress, take the right medications for flares, and have a good support system. But is this enough? There's a relationship between bone diseases and mental health, specifically osteoporosis and depression. Nearly 87% of people with osteoporosis have mild to moderate depression, and researchers believe that this could be a symptom. Correlating, both exhibit low levels of vitamin D, inflammation throughout the body, and certain medications can cause people to get more depressed. I'd like to tell you an account from a patient, Mercedes, a 17-year-old in. I wish my rheumatologist had understood the impact of chronic pain from my juvenile idiopathic arthritis on my mental health. My first rheumatologist never asked about how I was feeling mentally, even though I exhibited lots of classic depressive symptoms. It wasn't until my new rheumatologist asked about my mental health that I was able to get help for it. This made a huge difference for me. Honestly, my arthritis probably would have been more manageable earlier. What I wish I could tell my first doc? Don't make people feel responsible for their own pain, and at least offer the opportunity to talk about their mental health. The Bare Bone Blog. It consists of volunteering opportunities. We offer volunteering for rehabs and hospitals in the most flexible way possible. We want to make it easier for people, teenagers like ourselves, to get volunteer opportunities. Another thing that comes with it is talking to the patients. We have a live chat feature, checking in on patients with bone diseases and learn more about their conditions. And talk to all sorts of people in general, because it isn't just the elderly that have arthritis, it's even teenagers like us. Finally, it's no surprise that teenagers lead the media. With blog posts, we want them to be student led. And teenagers get the chance to interview patients with bone diseases. We can highlight a unique perspective and change the way people view bone disease and health. We want to bring these patients voices. We want them to be a part of the conversation. Thank you for being here to make a difference.